So how will personalized medicine affect healthcare? It will change the role of the patient, obviously. We're already seeing this, that patients are developing greater knowledge of his or her own genetic risks. It will allow patients to develop an actionable lifestyle for reducing the risk of disease, shifting from sickness to wellness. It will allow greater control of patient-centered access to medical records, which are going to be very, very important in the future of medicine. And treatment decisions will be improved by patient education. So I think it's going to be much more bottom-up than medicine has been in the past. We're already seeing that trend develop with the internet and web-based understanding of illness. It's going to change the role of the healthcare provider. The physician is going to become a manager rather than a repository of medical information. It's inconceivable that any one physician can be expected to keep in his or her mind everything that they need to know. They're going to have access to electronic medical records and to all kinds of computing tools. So there will be a greater reliance on HIT for decision support. And hopefully that HIT structure that will be put in place as we speak will think about the future of medicine and integrate genomics within it. That's still an open question whether that's going to happen. There will be increased care through aggregate patient data. That is to say, we'll be able to aggregate millions of people to examine how people react to common drugs based upon different genetic predispositions or biomarkers, and there will be much greater understanding of what medicine can be in the future. Medicine will be highly networked, team-based, and of course, and I don't have time to go into this, this will also raise new ethical and legal questions. There will be new strategies for the pharmaceutical industry. The uncertain economics of drug development and commercialization could be very disruptive for companies that are not able to adapt to this new era. There could be new regulatory mandates which disrupt development budgets and market plans. FDA, for example, could, and I don't think it's inconceivable, demand greater efficacy than it ever has in the past, and thereby pushing to get more diagnostic information put into the drug applications before they're approved. That hasn't happened yet, but FDA is very proactive because their mandate is safer and more efficacious drugs. And I'm arguing that the way to get to safer and more efficacious drugs is through a better understanding of biomarkers. And then personalization of drugs will require, and this has been difficult, partnering with diagnostic companies in the future. The Personalized Medicine Coalition was created to address these issues to help increase investment in and adoption of personalized medicine. I would say there are three great barriers. The first is reimbursement, the second is regulatory, and the third is physician education. Our systems were put in place before this potential was developed, and there is a legacy not to want to change those systems to encourage the advancement of personalized medicine, even though, as I've argued, patients will benefit and society will benefit overall. So these are the issues that we work on, and I would invite your participation in the conversation that we have started. It is a conversation where we don't know the answers, but invite participation and effort to overcome the barriers that I've talked about and to think through how we can create a better environment, again, for the benefit of patients. So with that, I'll close. This is our mission statement, and I think we have time for questions. Okay, well, thank you very much.